Joint Action CHRODIS Plus is a 3-year initiative from 2017 to 2020 funded by the European Commission and participating organisations. The QCR tool is a set of recommendations meant to be applied to develop, improve and assess practices, programmes, strategies and policies in various domains such as prevention, care, health promotion, education and training, and can be used for the management of any chronic condition. The QCR tool consists of 9 recommendations that can be used to ultimately improve prevention and quality of care for people with chronic diseases. The design should clearly specify aims, objectives and methods, and rely upon relevant data, theory, context, evidence, and previous practices, including pilot studies. Using appropriate mechanisms such as self-management support, shared decision-making, education information, and active participation should promote the empowerment of the target population. The evaluation outcome should be linked to action to foster continuous learning improvement or to reshape the practice. All outcomes should be shared among relevant stakeholders. The practice should consider relevant evidence on effectiveness, quality, safety, as well as the underlying risks of the target population. Educational elements such as health literacy, self and stress management should be used to promote the empowerment of the target population. Objectives must be transparent, while potential burdens should be addressed to achieve a balance. This practice should include organisational elements, identifying the necessary actions to remove legal, managerial, financial or skill barriers in order to align staff incentives and motivation with the practice objectives. The practice should be supported by different communication techniques while defining an acceptable policy to ensure participation in the process of change. Integration with all relevant systems should enable effective linkages between all relevant decision makers and stakeholders and enhance the interaction of the target population with the relevant systems. The sustainability strategy should consider a range of contextual factors assessing the potential impact on the population targeted. The QCR tool was developed in Joint Action CHRODIS through an extensive process and sound methodology involving more than 200 experts from a wide number of organisations across Europe and from a variety of professional backgrounds. The QCR tool was implemented in 8 countries. Following implementation, the QCR tool proved to be a valuable framework that triggered representatives to take new and different pathways. The QCR tool was translated into local languages across the continent to ensure that all stakeholders felt a greater sense of ownership. Overall, the differentiating nature between the pilot countries influenced the local approach of the QCR tool. The QCR tool starts a valuable and practical framework that can be used by decision makers, healthcare personnel and patients to support the implementation of good practices to improve prevention and quality of care for people with chronic diseases.